One of the things I see in my work is confusion around the difference between PrEP, PEP, and DoxyPEP. The plan of this video is to help explain everything so you too can be an expert on how to maintain your sexual health. In case you haven't met me, I'm Dr. George Forgan Smith. I am a general practitioner with specialist training in HIV and sexual health based here in Melbourne, Australia. There are a number of ways to take PrEP. The first is tablet form, which can be taken every day, called daily PrEP, or PrEP on demand. PrEP on demand is not for everybody. It's not effective for people who are living with hepatitis B, and there are slight differences if you are a cis female or a trans female. If you would like to learn more about this, I'm happy to send that information through to you. There are also injections. There are currently 2 injections available in the world. One is a cabotegravir injection, and that is given every 2 months, or a lenacapavir injection, which is given every 6 months. Currently in Australia, whilst these are able to be given, they are not funded by the medical scheme. Talk with your doctor about what options are available in your local area. PrEP only prevents HIV infection. It has no impact on any other viral infections or on any bacterial infections such as chlamydia, gonorrhea, or syphilis. PEP is a rescue treatment. We use PEP to prevent HIV infection after a person has had a significant exposure. For example, condomless insertive sex, condomless receptive sex, sharing of needles in situations where you're not sure of the HIV status of the other person. HIV PEP is a longer-term treatment of at least 28 days, and it may involve using 1 or 2 tablets, depending on the level of risk. If you have had HIV PEP previously, it's probably worthwhile talking with your doctor about whether you could be a candidate for PrEP. It's better to be prepared than to be reactive. PrEP is so much easier to manage than PEP, and I highly recommend talk with your doctor if you've had PEP. Should you be considering PrEP? If you have had an incident where a condom breaks, where you have missed some of your PrEP tablets, or you have been assaulted or had a needle stick injury, PEP may be an option for you, and I urge you to seek medical attention quickly. PEP is only effective within the first 72 hours of exposure. So if it happened in the middle of the night or over a weekend, or you're struggling to get an appointment with a doctor, I urge you to go straight to an emergency department or your local sexual health service, where they will be able to help you get started on your HIV PEP treatment. DoxyPEP is a different kettle of fish. DoxyPEP is a prevention treatment taken after you've had sex to prevent bacterial STIs, in particular chlamydia and syphilis. It does nothing to do with HIV. If you're on DoxyPEP, you are being treated to prevent syphilis and chlamydia, however, not HIV. So if you want protection for HIV and bacterial infections, it's important that you talk with your doctor about being on both medication regimes. DoxyPEP is 200 milligrams of doxycycline taken within 72 hours after you have had sex. It is highly effective against chlamydia and syphilis. It's not so good for gonorrhea prevention. DoxyPEP is a very helpful treatment for people who have had frequent episodes of either chlamydia or syphilis. If you have had more episodes of STIs than you care for, then it's probably worth talking with your doctor about whether or not DoxyPEP is for you. Some of the mistakes that I see is people believe that when they're taking their DoxyPEP, they are being protected against HIV. You are not being protected against HIV with DoxyPEP by itself. It only works on syphilis and chlamydia. For HIV prevention, you need to take PrEP, or pre-exposure prophylaxis. DoxyPEP does not need to be taken every day. It has a long effect of around about 72 hours. So you do not need to take it every day. In fact, if you're having a long season of sexual success, I recommend taking your DoxyPEP every 3 days. This reduces the burden of side effects and it will not overload your body with the medication. DoxyPEP is around about 85% effective in reducing the incidences of chlamydia and syphilis. It is still important to get your regular sexual health screening to make sure that you have not picked up anything other than syphilis or chlamydia in the last sexual encounters that you've had. It is important to have that regular routine, whether you are on PrEP, PEP, or DoxyPEP. Stop in and see your doctor, and I recommend every 3 months to make sure that everything's tip-top condition in your body. DoxyPEP can have some side effects. That includes irritation to the lining of the stomach. So when you take your DoxyPEP, it's important to wash it down into the stomach with a big glass of water and to stay vertical for 20 minutes after you have taken the tablets. That gives time for the tablet to dissolve and it can't irritate the stomach after that. Some people can be sun sensitive after they've taken DoxyPEP, so it's important to avoid getting sunburned, otherwise your skin can get quite inflamed, red, and even sore. PrEP can have some side effects. In particular with the injectable PrEP, there can be a bit of pain and discomfort around the sites of the injections. With PrEP tablets, some people can get a little bit of nausea, bloating, and constipation when they first start the medication. If you're taking daily PrEP, this often settles quite quickly. If you are taking PrEP on demand and you're getting the bad bloating and side effects, you might be better off taking PrEP daily and just waiting to get through those initial symptoms. A lot of people can find it very easy to take, and to be honest, the bloating and gut effects are quite rare. I don't see it very often in my patients. With oral PrEP, there is a very rare side effect of reduced kidney filtration. In this case, I've been doing PrEP for more than 10 years and I've only ever taken one person off PrEP because of reduced kidney filtration. We have other ways of providing PrEP, including the use of a secondary drug called Descovy, which can be useful in people who have lower kidney filtration. Talk with your doctor and be aware that your kidney check is every 3 months when you're taking PrEP on a daily basis. If you're not sure about what to say to your doctor, I recommend being open and honest. Hey, I'm taking PrEP. I also want to help prevent other infections. Do you think DoxyPEP might be an option for me? Or, hey, I don't always use condoms and I would like to reduce my risk of HIV and other infections. Can we talk about PrEP and DoxyPEP? This might be something that's useful for me. If at first you don't get a great response from a doctor, I recommend you seek out a doctor who does this on a regular basis. Look for doctors who work at either gay health clinics or at their local sexual health services. Keep in mind that PrEP is for everybody who is living at risk of acquiring HIV. DoxyPEP is for everybody who is at risk of acquiring a bacterial STI. You don't have to be gay to access these services. You just need to find a doctor who does regular sexual health and have that conversation. Initiate that conversation. We are here to help you. I would rather help somebody get onto PrEP than have to offer treatment for HIV, which is a lifelong treatment. So look, the bottom line is that PrEP is pre-exposure prophylaxis and it is used to prevent HIV infection. There are ways to take it either as a daily tablet, tablets only when you need it at a time of risk, or you can get injectable versions, and that can be every 2 months or every 6 months, depending on availability in your local area. It's important to talk with your doctor about the options for you. PEP is post-exposure treatment for preventing HIV infection. It is considered a rescue treatment. It is urgent that you get to the doctor as soon as possible. It is only effective within the first 72 hours of exposure. The earlier you see a doctor, the better. If it's outside of hours, go to your emergency department and one of the medical team there will be able to help you get access to PEP. If you have taken PEP, it's important to talk with your doctor about PrEP as it might be a useful addition to you. DoxyPEP is used to prevent bacterial STIs, in particular chlamydia and syphilis. It's a medicine that you take after you've had sex. It's a medicine that if you need to take on a regular basis, you would not take more than 2 times a week. Every 3 days is perfectly fine. You don't need to take it every single day. DoxyPEP does have some side effects, including irritation of the stomach, and if you get sunburn, your skin can get quite red and inflamed. Talk with your doctor about whether DoxyPEP is something that's useful for you. I hope you found this video helpful, and if you'd like to learn more, I've created some links that go deep into those various aspects that we've discussed. Stay safe. Happy to answer any questions below.